नवरात्रि के चौथे दिन हम माँ कुष्मांडा की आराधना करते हैं। माँ कुष्मांडा आरोग्य और संपत्ति की प्रेरक है। माँ कुष्मांडा को इस यूनिवर्स की क्रिएटर भी कहा जाता है और इसी दिन को हम ब्लू डे के तौर पे भी मनाते हैं। आज का यह एपिसोड ऐसे ही एक व्यक्तित्व को समर्पित है। ये कहानी है पुणे के सुप्रसिद्ध कैंसर सर्जन डॉक्टर स्निता सिनु कुमार की। डॉक्टर स्निता सिनु कुमार ने भारत के सर्वोत्तम टाटा मेमोरियल हॉस्पिटल में से MCH इन सर्जिकल ऑन्कोलॉजी की पदवी ली। इन्होंने आज तक 1000 से भी ज़्यादा कैंसर सर्जरीज की है। महिलाओं के कैंसर में इनका विशेष योगदान है। डॉक्टर स्निता सिनु कुमार की एक सामान्य लड़की से एक सक्सेसफुल कैंसर सर्जन की कहानी हम सब के लिए प्रेरणादायी है। तो आओ चलो सुनते हैं डॉक्टर स्निता सिनु कुमार की एक कहानी उन्हीं की जुबानी।
I always wanted to become a surgeon. Sir, I was seeing cancer for the first time. Cancer is just a word. It is like any other illness. I knew that this was a very rare disease. 1 in 1 million people are affected by this cancer. It was a patient of cancer, but I was not trained. So that patient encouraged me and I got motivated. We still don't have an absolute answer to cancer. So you can understand, she had a 2-year-old daughter and she got diagnosed with breast cancer at the age of 35. A social involvement is also extremely important and it is very encouraging to see that it exists. My name is Dr. Snita Sinu Kumar. I am a surgical oncologist. I operate on patients who have been diagnosed with cancer. This is a specialized field wherein patients who have been diagnosed with cancer and require surgery come to me. Apart from being a surgical oncologist, I also operate on patients who have a cancer which has metastasized in the peritoneal cavity, which is called as peritoneal carcinomatosis. Peritoneal surface oncology is a new branch and a specialized branch of surgical oncology. My main interest in surgical oncology is gynec oncology, which means cancer affecting women and organs of women, like the uterus, ovary, breast, cervix. This is generally surgery is not a branch which is selected by women, but I always wanted to become a surgeon. Immediately after my MBBS, I was very clear that I wanted to pursue surgery as a specialty. So I have a very small experience during my general surgery training. There was this 35-year-old gentleman who had come to the hospital. I was a resident, very busy with work, and this 35-year-old gentleman was diagnosed with oral cavity cancer. It's a very common cancer, but to see a cancer, I was young, this gentleman was young, and he was diagnosed with cancer. I was seeing cancer for the first time, surgery itself, and then here comes a patient in front of me with the diagnosis of cancer. So, but what I understood is all through the treatment, this patient was extremely positive, smiling, and he was a photographer by profession. So he would take pictures of us in the ward working, of other patients, and I was, cancer treatment is not very easy. It is quite challenging and quite demanding. But all through the cancer treatment, this particular patient was extremely positive. So I asked him one day that, how can you do this? You're undergoing the treatment and yet you're so positive and you're smiling and you take photographs, you make us happy. So he told us one thing, ki, Madam, I see all of you are working so hard. All of you are trying to do the best for me. The least I can do is wear a smile and be happy. So I thought that there can't be any other branch that I can take other than becoming a cancer surgeon, because despite of all the negativity, despite of all the pessimism, there is always hope, there is always happiness that can prevail in this kind of a morbid disease like cancer. So the first thing that I would like to tell everyone is that the cancer is just a word. It is like any other illness. The trauma, the fear, the taboo that is surrounded around this word cancer has to be first obliterated or first to be taken out of one's mind. So I have to prepare myself in a very similar way. Only then will I be able to convince and project on my patients. It is like any other treatment. It is curable. There is a lot of treatment available. So when I had my first patient in my practice, it was a breast cancer. It was a lady with the breast cancer. She was 50-year-old. She came to me and she said that, Madam, I have been diagnosed with cancer and I'm coming to you for treatment. The thing that I told to her is that you are come to me with that faith and I'm going to try my best to help you and cure you. So treating and being treated is a mutual thing. When a patient walks into me with that kind of faith and confidence, with that faith and with that confidence, I go ahead and start treating my patients. Cancer can affect almost any organ in the body. Head and neck cancer, which is very common in our country. Head and neck cancer, breast cancer and cervical cancer are the commonest cancers in our country. So there is a special type of cancer which is called as peritoneal cancer, in which the cancer spreads in the abdominal cavity. Now, this is a very challenging and niche specialty, a very challenging cancer to treat. Very few surgeons in the country are trained to do this surgery, and I had the good fortune and opportunity to train in this special branch of cancer called as peritoneal surface oncology. I underwent a training for a year in the National Cancer Institute in Italy, Milan, and I'm one of the few surgeons in not only in the city but also in the country performing these complicated surgeries which come under the bracket of peritoneal surface oncology. And HIPEC, also known as hypothermic intraperitoneal chemotherapy, is a special modality used to treat these cancers. Maybe a few years in my clinical practice, there was a patient who presented to me with a cancer which was spread in the entire peritoneal cavity, right? At that point of time, this was a very rare. I knew that this was a very rare disease. 1 in 1 million people are affected by this cancer, and I realized this patient has come to me. But am I equipped or am I trained to treat this cancer? So when this patient came to me, I was not adequately trained to treat this cancer, which encouraged me to go ahead and get trained for this cancer, and now I'm able to contribute to treating such complicated cases and treat such complicated cancers which have spread within the peritoneal cavity. What motivates me is the success that comes out of putting in that much of effort, being able to treat patients of cancer, see them get treated, become successfully treated, become successfully cancer-free, and get back to their normal daily lives and routines. So every time this happens, it motivates me to do better and better, keep learning, keep renewing my skills and contributing and helping them to get back to their lives normally. Honestly speaking, I can't really pinpoint one single case because every single case is unique and I'm learning every day from every single case. So I can't say this case has added meaning to my life. Like I gave you the example. There was a case where I knew that I was not adequately equipped to treat that patient. It was a patient of cancer, but I was not trained. So that patient encouraged me and I got motivated to learn something new. So I'm learning from every case. I'm learning that my training does not stop with the degrees that have accumulated. I'm learning from every patient that in order to provide better outcomes, I have to keep learning lifelong. Only then will I be able to learn new things, understand new treatment modalities, and help my patients better. We all go through stress in our professions and careers, and like I said, this is a demanding profession. But on a personal level, I enjoy listening to music. I am learning Kathak, which is a dance form, and this gives me a lot of happiness and joy, and it's a medium of relaxation for me. I draw mandalas, so it's my form of meditation and relaxing. And of course, as and when I get time, I spend time with my family. We enjoy dinners together, outings together. I like to travel, so whenever time permits, I'd like to visit new places, understand new cultures. That's how I work-life balance, yes. So this is a very important aspect. We hear a lot of things about cancer, a lot of information is there on the web, but people are not able to understand how to process that information. So as doctors and as cancer specialists, it is our responsibility to ensure that that patients are able to understand what they need to do, what is cancer screening, what they need to prevent cancer. So health talks are extremely important. With me, I engage in a lot of health talk activities, screening programs, camps, interviews that spread awareness about cancer, about cancer screening, early detection, because cancer, if detected early, not neglected, the signs and symptoms picked up at the right time, the treatment performed at the right time can be highly curable. So this message is extremely important. This point is extremely important, is to not ignore the warning signs in your body and to meet a specialist to understand whether something wrong is happening. So I engage in a lot of health talks and screening camps and screening programs to create awareness about cancer. Cancer treatment can be very expensive. We understand that. And the organization and the hospital that I work with have got a facility to perform surgeries and cancer-related procedures at subsidized rates. And sometimes we also do cancer surgeries free of cost. There are a lot of NGOs and organizations that approach us, and from time to time over the last few years, I have been very regularly supporting their cause and not only engaging in the screening activities, cancer prevention activities, but also when it comes to treatment, helping patients with their finances, operating for free when and wherever possible. Few individuals across the country, we have a collaborated organization where we exchange our ideas and we publish papers and deliberate on newer ways to identify, cure and treat cancer. One of my major concerns about cancer care is the screening part. The awareness for cancer has to increase. People have to be more focused and dedicated about healthcare, invest more in routine health checkups, examinations, because that is the only way by which we can try and prevent cancer. The second thing is that we have to have more equitable distribution of cancer treatment. There is a lot of disparity in the cancer treatment in our country. So cancer treatment has to be made more affordable. So my interest and endeavor would be to be associated with organizations, NGOs, that help to make cancer treatment more affordable and more approachable to the general population. And of course, my interest is in ovarian cancer and peritoneal surface malignancy. So going forward, I would like to do research and more academics, involve in more academical activities to further research in peritoneal surface oncology and ovarian cancer. Yes, there is a lot of advancement that is happening in cancer treatment, not only in the form of newer technologies, but also in the form of new drugs and drug development. As I mentioned earlier, that as a surgical oncologist, we have to focus in a particular area that interests us and do a comprehensive research, comprehensive treatment in that area. For me, it is ovarian cancer and women malignancies and peritoneal surface malignancies. So in the future, I see myself contributing a lot to that particular specialty in terms of not only learning new technologies, but also ensuring that I can apply it on my patients. So there is a lot of noise nowadays about artificial intelligence. I would like to really understand how this can help us as surgeons and how it will help our patients, how we can translate this artificial intelligence and knowledge to better medical care. So I'm very excited about this aspect of technology that is slowly getting introduced into the medical field and medical science. My only message to anyone who is interested in cancer surgery or taking up oncology as a branch is that it is a time-consuming field. It requires a lot of dedication and passion. There will be days and times when we get frustrated, but as I mentioned earlier, that you have to enter this field with the responsibility and understanding that you have a responsibility towards the patient, because there is no end to oncology. It is an evolving field. We still don't have an absolute answer to cancer, so you can understand it's not an all or none phenomena. Even today, we know that patients once treated with cancer do have a risk of cancer coming back again. So it is an open-ended disease wherein we are still finding answers. So we have reached a long way, but there is a long way still to go. So if you understand this aspect of cancer and cancer treatment, oncology is the field for you. If you don't understand this aspect, if you want a quick solution to healthcare problems, oncology is not the branch. So I'll start off by saying that when a patient is diagnosed with cancer, it is not just the patient who is affected. It is also the entire family. The dynamics of the entire family also gets changed and affected, and as well as the financial situation. A patient of mine who was a young mother, she had a 2-year-old daughter, and she got diagnosed with breast cancer at the age of 35. It was incidentally detected. It was a nuclear family. Her husband and her daughter came to my clinic and with the diagnosis of cancer, and of course it was a shock to the entire family. She said that the husband did not have parents, and neither did the patient. So they were just two of them, and they had a daughter. So we knew that she was going to undergo chemotherapy, radiation. She had to undergo surgery. He had his job, and they had a 2-year-old daughter. So what was beautiful about the whole thing is that her neighbors, the hospital where I'm working, they had a very strong support group. So there were volunteers when she was there in the hospital. There were volunteers helping her during her chemotherapy. There were volunteers taking care of the daughter, and the husband was very free to go ahead and do his work. When she went back home, her neighbors came forward to help her. So this kind of a community involvement, this kind of a social involvement is also extremely important, and it is very encouraging to see that it exists. So the word cancer should not stop anyone from living their life. The word cancer should not stop anyone with fear. Today it is, I think, 5 years, and she's doing well. Her daughter is 7 years old. She just came for a follow-up, and her life has gone back to normal. Like, she never had to go through this disease. Cancer is just a word. Always stay positive. Meet the right doctor. There is a lot of treatment available for cancer today in 2023. There are a lot of opportunities for cure, diagnosis at the right time, at the right place. A right treatment can offer cure, can offer success. My only message would be is that the fear and taboo surrounding this disease has to be completely thrown out, and the only way we can deal with this disease, with this illness, is with positivity and hope.